Let's have a look at the urinary system. So the functions of the urinary system are to regulate the chemical composition and volume of the body fluids. And of course, that is osmoregulation, so looking at regulation of fluids. Another function is to remove nitrogenous waste products and excess water from the body, and that process is referred to as excretion. And likewise, another function is to act as an endocrine gland by the secretion of the hormone erythropoietin. And we've talked about erythropoietin previously when it comes to the development and stimulation of growth of red blood cells. Overall, the functions of the urinary tract, the main function is to maintain homeostasis, so equilibrium within the body. The components of the urinary tract that we'll talk about are kidneys and their component parts, ureters, bladder, and urethra. And looking at this image here, this would be a good image to get to know. So we have the right kidney, the left kidney, the two ureters here, which are the tubes that run from the kidneys into the bladder. We have the urinary bladder, and then we have the urethra. It's important to note, we'll talk about kidneys, but the right kidney always sits in dogs and cats, it always sits more cranial in the abdomen than the left kidney. This would be another image that would be good to get to know. So looking at kidneys themselves, they are retroperitoneal, which means that they're not actually within that peritoneal cavity of the abdominal cavity. So you know how we have the peritoneum, which is the thin membrane that encapsulates generally all of the abdominal organs. Kidneys actually sit outside of that peritoneal membrane. So they are kind of glued to the inside wall of the lumbar aspect of the dog and cat. So they're kind of glued to the inside of the animal's back. The right kidney sits slightly more cranial than the left, so that's good to know for labeling when you have images to label for looking at a dog and a cat. Then the right kidney, of course, is more cranial. And the function of the kidney is to filter wastes from the blood and then excrete the wastes as urine. There are four key areas of interest of the kidney: the capsule, which is the protective outer layer, the cortex, which is the dark red outer layer, and it contains some components of the nephrons. The medulla is the inner layer, and it contains components of the nephrons and the renal pyramids. And then we have the renal pelvis, which is a connective tissue funnel that collects urine to send to the ureter. So this would also be a good image to get to know. So looking at those four main components, the capsule is the outermost layer of the kidney. So it's a fibrous tissue capsule that maintains the kidney's shape and structure. And then we have the cortex, which is this area here, which is the second outermost layer. So we've got the capsule, which is a thin membrane. The cortex is deep to the capsule, and it's a thick layer of tissue. And then the medulla is sort of the inner layer of the kidney, the middle layer of the kidney. Then we have the renal pelvis, which is the innermost layer of the kidney. So really important parts of the kidney are these tiny little microscopic areas, little functioning units called the nephrons. And the nephrons are the basic functional unit of the kidney. They filter blood and they produce urine. So looking at this picture here, I got this from an online website. It's a YouTube site called Handwritten Tutorials, and I highly recommend it. It's a man who draws anatomical structures and then discusses them and discusses their physiology as he goes through it. So if you're looking for a little bit extra information, I suggest that you head over to Handwritten Tutorials. I put a link on your Blackboard page. So blood supply, if we're looking at the nephron, so just going back, this in itself is the nephron. So it's the basic functioning unit of the kidney, and we'll go through each of the components of the nephron. And then it's important to note where the nephrons sit within the kidneys. So the nephrons sit partially in the cortex of the kidney and partially in the medulla of the kidney. Blood supply of the nephron is carried to, blood supply in general with the kidneys, it's carried to the kidneys from an extension of the aorta. So remembering that the aorta is the largest artery in the body, and it brings oxygenated blood all the way down the body. So an extension of the aorta called the renal artery. When we're talking about renal, that means kidney. So of course this is the kidney artery. Blood enters the glomerulus, which is a part of the nephron, right here. So blood enters the glomerulus through capillaries, and it works its way through the proximal convoluted tubule, down the loop of Henle, to the distal convoluted tubule where filtration occurs. So looking at this, we have our, our parts of the nephron. So we've got our glomerulus where the blood comes in. We have our proximal convoluted tubule. We have our loop of Henle. And then we have our distal convoluted tubule. So those are some key components of the nephron that are important to get to know. And it's within this, through the proximal convoluted tubule and the distal convoluted tubule, where a lot of the filtration of the blood is occurring. Blood is, so looking at this image here, we've got the arteriole that brings to and the arteriole that takes blood away from the glomerulus. We've got the proximal convoluted tubule, the loop of Henle, and then this is the distal convoluted tubule. Here's another picture from another textbook that gets a little bit more complicated, but it may be helpful because everybody learns a little bit differently. So again, we've got the glomerulus, the proximal convoluted tubule, the loop of Henle, and the distal convoluted tubule. So picture blood coming in from a branch of the aorta, branches into the renal artery, and then it branches down into these little capillaries and the afferent arterioles, and they bring blood into the glomerulus, at which point it's then circulated around the proximal convoluted tubule, loop of Henle, and distal convoluted tubule for filtering. Good products are reabsorbed back into the bloodstream through this process. Wastes are gathered in the collecting duct. They make their way through the calyces into the pelvis, into the ureter as urine, and then the urine is sent to the bladder, and the clean blood leaves the kidney through the renal vein. So again, going back to the nephron, blood flow is coming in through the glomerulus, it's working its way through the proximal convoluted tubule, and as you can see here, a lot of the water is taken out of the blood in the proximal convoluted tubule, and it carries on through the loop of Henle, at which point we start to see some of the substrates being removed. So if we carry on loop of Henle here, up the distal convoluted tubule we're losing, so we're taking a lot of the sodium back into the body. And then furthermore, you can see here, sodium continues to come back into the body. It's leaving the distal convoluted tubule, and other ions such as hydrogen and potassium are getting dumped into the distal convoluted tubule. And the purpose of that, the body gets rid of excess hydrogen ions, extra potassium ions, so that it can be excreted out as a waste product as urine. So once it makes its way through the distal convoluted tubule, then of course the clean blood, the blood that has had the water taken back into it, that's taken some of the sodium back, the clean blood makes its way to the renal vein to leave the kidney. The rest of the products that are still in the distal convoluted tubule, this is now urine, and it makes its way down to the collecting duct. The blood in the renal vein, so the vein that is leaving the kidney, is the cleanest blood in the whole body. And the reason for that is the kidneys have just filtered that blood and taken out all of the waste products from that blood. And then it's sent back up to the heart for reoxygenation and distribution in the body. So going back, looking at the anatomy of the kidney, so we talked about it a little bit. So we've got the renal capsule, which is the outermost fibrous layer. We have the cortex, which is this sort of secondary layer of the kidney. If we look here, we have the medulla, which is sort of the middle layer of the kidney. And then we have the renal pelvis, which is this big funnel, which eventually turns into the ureter. So urine comes in as blood, technically. So blood comes into the kidney through the renal artery, works its way through up into the nephrons, which are sitting between the cortex and the medulla. And then, of course, that blood gets filtered through the nephrons. The waste products are released from the collecting duct of the nephrons, and they work their way through the renal pyramids, down the calyces, so the minor and the major calyx, and get emptied into the renal pelvis. At which point, this is urine in the renal pelvis. And of course, the urine then makes its way to the ureter. The blood that we know was filtered makes its way from the nephrons back through, out the renal vein, and then back into circulation. It's my handy little drawing. So here is, of course, the complete picture of what the nephron looks like with its parts labeled. So again, blood's coming into the glomerulus, working its way down proximal convoluted tubule through the loop of Henle up the distal convoluted tubule, where again, in the proximal convoluted tubule, not too much is happening. We might be taking back some water. Distal convoluted tubule, we're taking back some sodium and we're adding some waste products to the material in the distal convoluted tubule. And then it works its way to the collecting duct, whereby at this point it's urine. Working its way. So 65% of reabsorption is taking place in the proximal convoluted tubule. The loop of Henle is regulating the concentration of urine, so how much water is in the urine. And then, of course, the distal convoluted tubule is where the final adjustments are made to the urine components. And then, when it gets to the collecting duct, it is now urine. So when it's in the collecting duct, the final adjustments to the volume of urine are completed. So what that means, we know that the loop of Henle had a role in regulating the concentration of urine, so how much water is in the urine compared to other substrates. When it gets to the collecting duct, we have this hormone called the antidiuretic hormone, which plays a large role in adjusting the volume of urine. And we'll talk about some complications a little bit later on when animals don't have the antidiuretic hormone. So then again, this is exactly what I explained earlier. Now that that urine has passed through the collecting duct, works its way through the renal pyramid, into the minor calyx, into the major calyx, into the large funnel, which is the renal pelvis, and out the ureter into the bladder. So a bit of review. What does erythropoietin do? Well, we didn't talk about it too much, but we've discussed it previously. It's created by the kidneys and it stimulates red blood cell development in the bone marrow. What does it mean when we say that the kidneys are retroperitoneal? Well, that means that they are not within the cavity formed by the peritoneal membrane. And then that's it. Next question. The outer protective layer of the kidney is called the renal capsule. What is the basic functional unit of the kidney? That is the nephron. Where are the nephrons located? So within which layers of the kidney? They're located in between and within the cortex and the medulla of the kidney. Blood in the blank is the cleanest blood in the body. So blood in the renal vein, so that's the blood that's leaving the kidney, and remember it has been fully filtered by the kidney and cleaned by the kidney. Explain the flow of blood through the nephron. So it enters the glomerulus from the afferent arteriole, works its way through the proximal convoluted tubule, then the loop of Henle, then the distal convoluted tubule into the collecting ducts. And just remember that at this point, the blood is connecting with the nephron to filter out all of those substrates and those waste products. And then, of course, as it's making its way through the convoluted tubules, it's becoming urine, and the clean blood is making its way back into the renal vein. Most of the reabsorption of ions takes place in the proximal convoluted tubule. So this is a bit of terminology, diuretics. Diuretics are drugs that cause the animal to excrete additional fluid through their kidneys. It often disrupts the amount of sodium that stays in the loop of Henle. So wherever sodium goes, water will follow. And if you carry on to pharmacology, you'll talk a lot about diuretic drugs and also understanding that concept of concentration gradients and how water follows certain ions. So the antidiuretic hormone we talked about a little bit, it regulates the amount of water that is emptied into or escapes from the collecting ducts. Antidiuretic goal is to concentrate the urine. So that should say to concentrate the urine. There is a clinical disease called diabetes insipidus, and this disease involves a lack of the antidiuretic hormone. So this causes the animal to diurese, which means they're losing exceptional amounts of fluid through urination. So this causes a low specific gravity of their urine and polyuria polydipsia. So they are drinking a ton and they're urinating a ton. Moving on down the line, we've worked our way through the kidneys, through the nephrons. We now have urine, and from the kidneys, it's going to work its way through the ureters. So the ureters leave the kidney at the hilus. They are hollow muscular tubes that propel water, which is urine in this case. They're made up of smooth muscle, and they engage in peristaltic waves. The majority of the epithelial cells that are found in ureters are transitional epithelial cells, and they allow for a lot of stretch of that endothelium. So with ureters, when the bladder is full, it collapses the opening of the ureter to the bladder. And what this does, it prevents urine from backing up into the ureter. So if we have a look here at this image, this is a sort of empty bladder. The ureter is open. It's able to empty urine into the bladder. When the bladder is super full, it creates a fold, kind of like the fold between the stomach and the esophagus that prevents some animals from vomiting. But it creates this fold to stop urine from backflowing from the bladder up to the ureters and into the kidney. So we've got urine, it's gone through the ureters, now it's making its way to the bladder, which is a large hollow muscular organ. The function is storage of urine, that's why we have bladders, and ureters enter the bladder on an angle, just as that picture demonstrated previously. The neck of the bladder is the caudal aspect of the bladder, so looking here, we've got the big bladder. This is sort of the apex of the bladder, and then the neck of the bladder is the thin area. And the neck of the bladder has a sphincter to prevent leakage of urine out into the urethra. So there we've got the neck and the apex. So here's an image of a dog, looks like a dog. I think it's maybe a cat. I think it is a cat. Anyways, it's an image. I forget already. And looking at this, if we have a peek here, this is a normal sort of half full bladder. Okay, so we've got colon, we've got some gas, which shows up as dark or black on the x-ray. We've got some poop, some stool in the large intestine. Here we've got the spleen, which always looks like a taco shell, a hard taco shell on x-ray. We've got the caudal aspect of the liver. We've got the stomach up through here, and then some small intestines are in the mix there. So here, the thing to look at is the normal bladder size. Okay, healthy, happy, normal bladder. This one is a dog who has crazy amount of bladder stones. So looking at the bladder here, if we go back, you can see it. having a look at the bladder again, we've got the colon with stool in it, we've got some gas, we've got that taco-shaped spleen, some small intestines, and look at this. So we know that on X-ray, things that are radio-opaque, such as bone or calcified objects, mineralized objects, will show up as white. So this is now the bladder that is absolutely filled with bladder stones. So that is bad news bears, and that animal would certainly require surgery. So this term, urolithiasis, is a word that describes the formation of stones in the bladder. And it could be stones, like we saw in the last image, or it could be sand and grit. And what it is, essentially, it's a mix of calcium and mineral deposits. And there are lots of things that definitely can contribute to this. Genetics definitely can. So if an animal's parent routinely had issues with bladder stones, then I would probably not breed that dog or cat. Specific breeds can get bladder stones and bladder crystals. Dalmatians definitely are one of the #1 most common dogs. Almost all of them get bladder stones and bladder crystals, as well as schnauzers, very common in schnauzers, and also low quality diets. And this is the tricky part because we often, as consumers, are sort of swindled or swayed's probably a nicer word, into getting some of these diets that aren't ideal for our pets. And the reason for this, of course, is marketing, but also if we're buying our food from the pet store person is doing the best that they know how to do to sell food, and they're doing the best. They think they're doing the best. They think they're selling you the best food. However, something that you should always look for with your food is to ensure that it has been clinically tested, clinically trialed. So animals have actually gone on this food for a long period of time and the results have been documented and compared instead of clinically formulated. So when we look at veterinary brands, they are always clinically tested, clinically trialed with animals. They're not just clinically formulated. Clinically formulated diets means that, we know that meat's good for dogs, we know that calcium's good, so we have results to indicate that those components are good, so we're going to put them in a diet, and that's our clinical formulation. We know things are good, we have studies to back up that those ingredients are good, so ideally, the formulation should be ideal. However, they're not actually testing it on patients. This, I'm just going to point out, is a huge issue right now with, this is a tangent, this is a side note, you will not get tested on this if you're in my class. This is a huge issue right now with all of those grain-free diets that people are feeding their dogs, and their dogs are getting cardiomyopathy. They're getting serious deadly heart disease. It is because these diets were not clinically trialed. They were not clinically tested. They were clinically formulated. It seemed like a good idea based on scientific evidence about ingredients, but they didn't do the research that they need to actually do. Anyways, back on this tangent, or this topic. In order to prevent urolithiasis, one thing that we should consider is definitely getting a clinically tested food from the veterinarian. So schnauzers and Dalmatians are probably both the #1 breed of dogs to get urinary stones and urinary crystals. So of course the dangers with urolithiasis is that these stones in the bladder can travel down the urethra and block the urethra. If we look here, this is a dog. So we've got bladder here, we've got a couple bladder stones there, but we know that dogs, or at least we'll learn that dog urethras curve in a backward C. They curve around their pelvis in a backward C shape. And then of course they end up in the penis, which is on the ventral aspect for the male dog. So looking here, if we trace that path of the urethra, we've got the bladder here with stones in it. And then the urethra you can't see because it's soft tissue on X-ray, but you can see these radio-opaque stones. So these stones are stuck in the urethra. And what that means, this dog probably cannot urinate. And if an animal cannot urinate, that becomes an emergency because A, their bladder could rupture. It will get bigger and bigger and bigger. It could actually rupture. Also, the kidneys need to get rid of waste products in the body. So if we can't urinate, those waste products are just going to accumulate and stay in the blood, which is really scary. So we can get an imbalance of waste products in the blood. So bladder stones themselves are not an emergency, but they need to be removed because we want to prevent the emergency where they get stuck in the animal. Also, bladder stones are quite painful for animals. It's continuously having stones rub the inside of their bladder. So a lot of time these animals get bloody urine. That's the #1 clinical sign. And they're often urinating small and frequent amounts because the stones are taking up a lot of room within the bladder. So they feel like they have to urinate and they only urinate small little amounts at a time. Again, urolithiasis prevention is a clinically tested high quality diet. And abnormal urination patterns, take your animal to the vet. Definitely take it to the vet. I see this a lot. People on like the pet zones on Facebook and stuff asking, oh, my cat, he's squatting in a litter box. He's not urinating a lot, or he keeps urinating around the house. Don't play around with that. If it's a male cat, they are at really, really, really high risk of getting blocked. Male dogs as well. We often don't know that they have bladder stones until an emergency occurs. If they're having abnormal urination patterns, please take your pet to your vet. All right, review. Diuretics cause the animal to drink more, urinate more, because they are releasing more fluid from their body. So diuretics are getting rid of fluid in excess amounts, so the animal is going to drink more and urinate more. So if your pet is ever placed on a diuretic medication, make sure they always have access to water, and you have to let them out all the time. An animal that lacks the antidiuretic hormone has this condition. That is diabetes insipidus, and that means that they are releasing way too much water, so they're not able to concentrate their urine. So they're just constantly releasing too much water in their urine. Where do the ureters leave the kidney? They leave the kidney at the hilus. The blank of the bladder is the caudal aspect of the bladder, and that is the neck of the bladder. A breed that is well known for developing bladder stones is the Schnauzer and the Dalmatian. Okay, so we're going to carry on with the urethra. I started to talk about it a couple minutes ago with the male urethra, but the urethra in general is different depending on if it's male or female and if it's a cat or a dog. So all these pictures here are fair game for tests and quizzes, so they would be ideal to get to know. So looking at the differences, so we've got a male dog, so we've got the bladder, and of course the prostate, which we'll talk about next week, and then the urethra is a backward C that works its way through the pelvis and then ventrally toward the tip of the penis. Here we have a female cat, so we've got the bladder, and then we have this short, straight urethra that exits on the caudal aspect underneath their anus. Likewise with the female dog, bladder, short, straight urethra, which empties out onto the caudal aspect of their body. And the male cat is kind of interesting. They have the bladder and then their urethra kind of takes a nosedive, but it's short and straight, and it again exits the caudal aspect of their body. So males, in general, they have the shared, their urethra is shared with the reproductive tract. So not only does the urethra carry urine, it also would carry ejaculate in order to breed and copulate with other animals. The male dog has a long and sort of backwards C-shaped urethra, and it exits on the ventral aspect. Female dog, like I said, short and straight, and it exits on the the caudal aspect of the body, ventral to the anus. Female cat, same thing. Male cats, short and straight, it narrows toward the caudal aspect. So the the urethra for the male cats actually gets thinner as it gets towards the opening of the body, and it exits on the caudal aspect, ventral to the anus. So here's just a quick diagram about where things are located and how to sex cats. But the male, it looks like a little donut with the prepuce and the penis in the middle. And the female, it kind of looks like, I don't really know what that looks like, but a circle with a slit in the middle. So cat penises are trouble, and we will talk about this when we talk about reproduction as well. But in general, cat penises cause trouble. So looking at this guy here, this is what a cat penis actually looks like. You pretty much never see cat penises unless they are sedated and they're letting it all hang out. But cat penises are well hidden underneath the prepuce or the sheath, which is that fold of fur-covered skin which protects and houses the penis. So looking at this penis here, it's an angry penis. You can tell because it's dark red, almost purple in color. Now, a couple things about this penis. The color is abnormal. Normally they are slightly more like a pink color. This one is purple, so I suspect that there's probably a blockage in there. And then I just want to point out here too, we'll talk about this with reproduction as well, but this penis, this is a cat penis, has tiny little barbs on it. You can see those little spikes? Those have a purpose when it comes to reproduction. You will see barbs on a cat penis if they are intact and mature. So that means that if they have their testicles and they're sexually mature, they develop these little barbs on the penis. And we'll talk about that more in the next lecture. So problems with cat penises. They are short, the urethra is narrow, and they're very close to the anus. So they live, we've got anus is the most dorsal in the caudal aspect of their body, and then we have testicles, and then we have their little penis. They're narrow, so the urethra narrows. So what ends up happening if they have sand in their bladder or if they have bladder stones, these small tiny little stones or grit can get caught easily in the narrow tip of their penis. Because they're close to the anus, they have a higher chance of bacterial infections. So cat penises, in my humble opinion, the structure of a cat penis sucks, and it predisposes them to a lot of these bladder infections, to bacteria in the bladder, and of course to blockage of urinary stones. So bacteria, when it gets into the bladder, it can change the pH of urine, and that change of pH of urine can be the precipitating factor of development of urinary stones. Once cats, male cats, get urinary stones, it's almost a guarantee that they're going to block. So they're going to end up with a penis blockage, which is a major emergency. I like to think of cat penises as Christmas tree shapes, and this is why they're so annoying and not very ideal. So if we look, see a little cat penis, how it narrows toward the end. The urethra is also narrowing toward the end, and if we think about that, it's kind of what a Christmas tree looks like. So because of their silly little Christmas tree shaped penises, they tend to get into more trouble if they have bladder stones because they're at a higher risk of blocking their urethra. So here again is a normal animal. We've got, this is a cat, urinary bladder. We've got the right kidney, the left kidney, large intestine, small intestine, stomach, liver, some fat, and the heart. Can't see the spleen in this one. So note the size of the urinary bladder. Looks pretty good to me. Ah, look at this one. This is a cat who is blocked. So this cat has stones that are stuck in its urethra and it's unable to urinate. Looking at the size of the bladder is massive. So this cat is in an extraordinary amount of pain and this cat is in an emergency situation. Signs of a blocked cat. So 90% of cats that block are male, but it could happen to a female cat. Clients will report that their cat is straining to urinate. So looking at this cat here in the litter box, the cat is often making frequent trips to the litter box and it's sitting there. It might release a couple drops of urine, but it keeps going back. So back and forth to the litter box. It might be dribbling small amounts of urine, even worse if it's blood colored. And then a lot of times they make this awful sad noise where it's just yelling like wow, wow, like they're just not happy and they're in so much pain. So if an owner ever calls you to say that, you know, my cat, I think he's constipated. Most often they think the cat's constipated. I think he's constipated. He keeps going to the litter box. I don't know why. Find out if it's a male cat. If it's a male cat, that cat needs to come to the vet clinic right away. Absolutely right away. It's an emergency. Also, what cats do when they're sick, they hide. So that's really scary because the owners might not notice if the cat's hiding. If they're in severe pain or if they're quite blocked, then you'll see vomiting. and you'll see panting because, again, we're starting to get some of those toxins building up in their body. So this is a point for you guys to know. If a client ever calls you with this, they need to bring their cat into the clinic. The treatment is a urinary catheter. We flush the bladder using a urinary catheter, put them on IV fluids, give them pain meds, etc., etc. So what you're seeing here is a cat anus, and its tail's underneath this towel. This is where the testicles would be if the cat was intact. And then this is a red rubber catheter that's being placed inside the urinary urethra. Prevention. So how do we prevent this? We don't want this happening to our cats. Prevention involves ideal body condition score, so that means not letting your cats get fat. Fat indoor cats are at higher risk of getting urinary crystals and blockages. High quality, clinically tested diet, and avoid heaps of treats. Increase that exercise and keep in mind environmental stimulation. Okay, it's our indoor fat cats who are neutered that are at higher risk because they are fat. They cannot groom very well in their nether regions, so they can't groom around their penis and their anus very well. Higher chance of bacteria sneaking in there, etc. So keep your cats in good shape. Explain why male cats are more likely to block than female cats and dogs. They have a narrow penis shape, they have a short urethra, and it's close to the anus. What are the signs that a cat may be blocked? Going back and forth to the litter box, straining to urinate, discomfort, vomiting, hiding, and yowling. How can we prevent our male cats from acquiring a urethral blockage? High quality, clinically tested diet, maintaining an ideal body condition score, and environmental enrichment. Keep them stimulated. That is it.